Hello, and welcome to our second discussion about COVID-19 and the legal considerations for pharmacists and pharmacies. We're doing this update as a way to get some information out to our clients. We've had a ton of questions after our first episode, and we wanted to just kind of provide you with some more information. So, as always, I couldn't do this alone, and I am joined by my colleague in the Kansas City office of Husch Blackwell, Wakaba Tessier. Wakaba, thank you so much for being here.
Sure. Thanks, Erica. It's always nice to be here. So it's only been a week since we recorded our last episode, and so much has changed. I know my life has changed, both personally and with respect to our clients. I've had client calls related to coronavirus preparedness. I know a lot of our clients are really busy preparing internally, and so we thought this would be a good opportunity to push out another episode to talk more specifics. I think last time, don't you think we were a little bit more general, things to think about? And now I think that we need to get down and talk more about the details. So let's go through an outline of what we're going to be talking about today. First, we'll talk about specific policy provisions, perhaps unique to pharmacies, that you should be thinking about enacting now. Second, we're going to talk about the pharmacist in charge and what happens if your pharmacist in charge goes down. I think a pharmacy is unique in that you're always required to have a PIC, and so what would happen if something were to happen to the PIC? What can you do now to prepare for that? Third, we wanted to talk about telepharmacy, as people are being encouraged to stay home and avoid crowds. There's going to be some more push towards telehealth, and so we thought it would be a good opportunity to introduce to you telepharmacy. And then fourth, we're going to talk about the emergency proclamations that states have enacted, and then talk a little bit more about patient advocacy, because I think we're in a really unique situation where pharmacies can help patients in this unusual circumstance.
So at this point, your organization probably already has a general policy in place that limits business travel as much as possible and informs employees of proper hand washing techniques and maybe requires hand washing. And so hopefully you have that policy in place. If not, there's probably a ton of samples on the internet that you can find in order to enact that. But we wanted to talk about some specific policies that you might want to have related to pharmacies. So one of those is to identify employees who might have a heightened risk of exposure. So, for example, if you have a pharmacist whose spouse is a registered nurse at a hospital and who is, seeing a lot of coronavirus patients every day, that person might have a higher risk of contracting it, or at least being subject to that 14-day quarantine. So you might want to think about certain contingency plans if you need to have, possible locums coverage, which we're going to talk about later, but what you're going to do in that situation.
I think it also goes to children too, right? I feel like my kids' schools might close after spring break. My kids are in elementary school, and so I guess the whole point of our this little segment here is to keep in mind that you just want to plan for these contingency. It's contingency planning. You might consider seeing if you can change the shift hours if you have to in order to provide patient care. So that's all I wanted to mention, is really it's all about the planning.
No, that's a great point. You might need to work with your employees to see, who can work around what schedule, because if, some people can't take their normal shifts because they have children and other people can, working around that to see how you can
accommodate.
Exactly. And then our second point is you might want to designate someone, a responsible employee, to monitor what's going on, because obviously everything's changing minute by minute, it seems. So monitoring those local, state, and federal guidelines as they're coming out. We just saw, I think, Wakaba 12 boards of pharmacy released updates about, things that are changing. And so it's really important that you know what's going on.
Yeah, I think the boards of pharmacy are doing this every day. I think I just got an email this morning that it's more like 22, like half of the boards, I think, have declared some sort of proclamation or guidance related to coronavirus and their contingency plans. And I guess to that point, it's not so we call it, what do we call it, Erica? The coronavirus management coordinator. It's also that the coordinator has to monitor these guidelines and proclamations and declarations and memos, but it's also the person, I think, that communicates with these local agencies. If there's an issue, and I don't want to steal our thunder here because we're going to talk about this next with respect to the PIC, but those are the people that are proactively reaching out to the Board of Pharmacy if there is an issue. So, for example, if your PIC goes down and you might not have a replacement, things like that, that person would be the one in charge to reach out proactively.
And to Wakaba's point, they would also maybe implement a communication plan, and that would be between all of the employees at the pharmacy so that everybody is aware of what's going on and you can continue to collaborate as a team. And part of your communication plan should be ensuring that you have a good email or phone number for everyone. Those practical considerations so that you know that you can get a hold of everyone if you need to, just to make sure that everything runs smoothly. And then lastly, you might want to think about certain policies to better protect your patients and employees. So I know in our office, there's signs everywhere about touching your face, which is something that I did not know how often I do it. And
right. And apparently, the most recent thing I read was that people touch their faces at least 90 times a day.
That's crazy.
Without realizing it.
And I think when they were doing that study, and correct me if I'm wrong, but the people were aware that, they were being watched of how many times they were touching their face a day. So you'd think that, they'd be even aware of it. You still touch your face a lot.
But my face gets itchy as soon as someone tells me not to touch it. So that might have been the issue too.
That could be it as well. And then also you might want to think about if you have a public restroom, obviously we know how this disease can spread based on surface contact, and so just making sure that you take the necessary measures to make sure it's clean and sanitized. That's going to be really important as well.
So as we alluded to earlier, you may want to start thinking about contingencies related to your pharmacist in charge. So, if your pharmacist in charge has to stay home because his or her child's school closed, or if that PIC has to stay home because he or she needs to care for loved ones. I think pharmacy is really unique in that you have to have a PIC in charge, right, of that particular facility. So it's never too late to start thinking about this.
And so while you might be thinking, a staffing or temp agency is the way to go, you will really need to be aware of the regulations in your state. So in California, for example, your PIC has to be employed at that location where your pharmacy is. And so obviously if they're from a staffing or temp agency, they'll be employed by the staffing or temp agency and not by your pharmacy. So you might also, if you have more than one pharmacist, want to start educating, the pharmacist who's not the pharmacist in charge about what those requirements are to be the PIC and sort of have them as your backup.
And there have been some of our clients who have used temp agencies to get a pharmacist to come in as a pharmacist in charge on a temporary basis while they look for a full-time PIC. So again, as Erica said, it really is state specific. So you want to keep an eye out on that. And then eventually, if you are at a place where you think, we have to replace our PIC, certainly you can do that, but there's things to keep in mind. The good news is for each state, there's a little bit of a reprieve. So there's some states that'll give you 30 days, 90 days, whatever it is, to be able to operate without a PIC. Because boards of pharmacy realize that it's not an instantaneous thing, that there's some sort of transition going on. But the bad news is there's a lot of limitations on who can be PIC. So for example, in Kansas, our neighbor, a PIC at one location can't be a PIC at another location or another pharmacy. It's okay for them to be listed as a PIC for purposes of a non-resident pharmacy license in another state, but for a brick and mortar, you can't be the PIC at one place and a PIC at another. Also in the same state in Kansas, that PIC has to be at that location for at least 30 hours a week. And so keeping that in mind is really important too. And some of the, the tips that we've gotten based on years of doing this is that some states, it's not in the regulation, it's not advertised, but if you have a non-resident license, for example, in Pennsylvania, they'll require you that the PIC for purposes of the non-resident Pennsylvania license has to be the PIC of your home state license. So if Mary is the PIC in Kansas, then Mary also has to be the PIC for Pennsylvania for purposes of the non-resident license. So these are some of the things that you want to start thinking about. And be prepared for it, because it's not as simple as replacing Mary with Bob, for example. And we've done this so many times that we actually have a pretty cool matrix put together so we can help. But these are things to start thinking about, I think.
And Wakaba, I think one thing that I've learned from working with you is that communication is so key. And so if you do find yourself in this position where, maybe your PIC is out for a couple of weeks, but they'll be back afterwards, communicating with your board of pharmacy what's going on, if it's, going to be longer than a couple of weeks, they're people too, and they understand that obviously this is an emerging situation and that, you can't control everything. So that communication is so important.
Right. And we're going to talk about emergency proclamations that the boards have issued here in a few minutes. But that is all premised on the fact that you're communicating with the board and making sure that the board is updating on your practices during these times.
So traditionally, we've seen telepharmacy have huge benefits in rural communities because obviously it's difficult to drive an hour, especially with certain conditions, to go get your medication at the nearest pharmacy. But obviously, as this situation continues to progress, telepharmacy could also be really beneficial in limiting that face-to-face contact with people and helping to spread the coronavirus.
Right. But let's back up a little bit. So I understand telemedicine. I can picture it, me talking to my doctor over a certain electronic platform. But when you talk about telepharmacy, can you tell us a little bit about what that is?
Yeah, so there's 4 main types of activities for pharmacy to participate in telepharmacy. So first would be remote dispensing. So, obviously shipping drugs or prescriptions to people. The second would be remote patient counseling, and that can happen in a variety of different ways. Some states let you do it over the phone. Some states require you have a secure video platform where you can see the other person, so you just need to check out the requirements in your state. The third is remote order entry review, so that's more for inpatients, and then also remote IV verification, which would also be more of an inpatient setting.
Got it. And so consistent with what we're talking about, recently on March 6th, the Coronavirus Preparedness and Response Supplemental Appropriations Act of 2020. We're going to call it the Coronavirus Appropriations Act because it's just so much easier to say that, but was passed. And part of that was relaxing some of the telehealth requirements under the Medicare rules. So there's definitely a trend towards telemedicine generally because of the spread of coronavirus. It's true for commercial payers too. For example, some payers are expanding access to telehealth by decreasing the members' out-of-pocket costs. One of our colleagues wrote a great blog post about it on our Healthcare Law Insights website, and it says that, for example, Aetna and several Blue Cross and Blue Shield plans have waived telehealth visit copays. Blue Cross and Blue Shield of North Carolina has taken one step further by temporarily covering telehealth services at the same rate as an in-person office visit. So certainly across the industry, there's been a move towards telehealth because we want to limit the in-person face-to-face visits.
So as it stands right now, 29 states have issued states of emergency, executive orders, or proclamations. And so generally, these are going to be different in what they say exactly, but generally the powers of these resources can include activating your state emergency response and mutual aid agreement, activation of your state emergency operations center and incident command system so that you're getting all the information into one place of what's going on. And then authority to reallocate and expend funds towards that emergency. And that's really important because obviously you're going to need to spend those federal funds and to get testing out. Deployment of your state personnel, equipment, supplies. And then receipt of out-of-state volunteer health professionals. So a lot of states will suspend certain requirements for licensure and allow people to come in and help and volunteer if needed, which makes a lot of sense, obviously. And then in that same vein, a lot of times they'll activate statutory immunities during this period so that you don't have, civil liability for certain, like if, for example, if you have to close your pharmacy because, you don't have a pharmacist in charge, someone can't come back and sue you for negligence or something like that. And then also suspension and waiver of rules, regulation, and statutes. And that's going to be a big one for pharmacies in particular because you're going to be seeing, maybe a suspension of particular requirement of your license.
That's right. So all of these state of emergencies, executive orders, and proclamations will have a cascading effect to each of your state boards of pharmacy. So let me just give you a few examples. Erica had mentioned, being able to practice within a certain state, even if you don't have a license. So for example, in North Carolina, they have allowed certain pharmacists and pharmacy techs who don't have licenses in North Carolina to be able to practice in North Carolina for a period of time. You must provide prior notification that you're going to do that, and that waiver ends immediately upon the end of the state of emergency in the location in which the person is providing services. Another thing that North Carolina did is only for the duration and only in the location of that state of emergency, if the permit holder becomes unable to operate it in the permitted location, the permit holder can operate in a temporary location within 10 miles of that original permitted location, so long as the permit holder can ensure that the drugs, devices, whatever you're dispensing are safe and secure in that temporary pharmacy. Again, you have to provide prior notification to the board before you do that. It's kind of similar in California, though I think it's a little bit more broader. So they say that the board has the authority to waive certain provisions of pharmacy law or regulations, and in order to do that, you have to submit a request to the Board of Pharmacy, and you have to provide them information about, obviously your license number, in a brief statement about the extent of the waiver sought, what relevant law that the licensee is requesting to be waived. And then you also need to provide a brief statement detailing how the declared emergency caused the need for the waiver. And so these are all outlined in the California Board of Pharmacy website, but I guess our point is, and we've been talking about communication with the board so much during our episode here, but I think as a rule of thumb, it wouldn't be a bad idea whenever you communicate with the board to have these things in place so you have a script and you know what you're asking of them. And certainly we can help craft that. We've actually done that, not in an emergency situation, but for patient care reasons where we had to ask the board to waive certain requirements in order to get certain medications into a state. So we have experience doing that, but now more than ever, I think you need to be prepared on that.
And that makes sense. So as we're talking about kind of bending the rules in an emergency situation, are there ways where pharmacists maybe will need to, I don't want to say bend the rules, but try to, bend the rules a little bit because the rules don't address emergency situations, for example, with insurance companies?
Right. So a lot of people have chronic illnesses, right? And you take medications daily or weekly or monthly, whatever it is, but you don't want to be caught without having that heart medicine or that diabetic medication or any potentially life-saving medication that you need on a routine basis. So you want to ensure you have those. It's really difficult, I think, for you to self-advocate and call the insurance company sometimes, but the person, and I didn't really think about this, but this has forced me to think that the person who has the most communication with some of these plans and physicians is actually the pharmacist. So as a pharmacist, it's going to be really important for you to be the advocate and to call up these plans and physicians and advocate for your patients to get a decent supply of these medications so they don't run out. And as I mentioned, a lot of insurers are now starting to relax their refill policies in the cases of these types of natural disasters and emergencies. There's an example. Anthem is now recommending its members to talk with their doctor about whether they need to increase their regular 1-month supply of medication to 3 months. We know that Blue Cross and Blue Shield of Oregon and Regents Shield of Washington have said that they're easing access to regular prescription drugs. So if you don't feel, if a patient doesn't feel comfortable calling up the insurer, I think that now is the time for pharmacists to step up and try to advocate for your patients.
That's a great point, Wakaba. And along with that point, and going back to policies, it might make a lot of sense for pharmacists to make sure that they're stocked up on those drugs. Especially the ones that, won't go bad as quickly, like insulin or, heart medication for the chronic diseases that you could give a 3-month supply or, even longer if the patient needed it.
Right. And we mentioned, and so I think this is the sort of out-of-box thinking that we need to start doing. I think, Erica, you read some articles that there may be some increased drive-through options. Well, maybe not options. Maybe that is going to be the only option that we'll see in the next few days to weeks, perhaps.
Yeah, I saw an interesting article that they're actually going to start doing coronavirus screenings through drive-thrus at hospitals. So the nurses will be all gowned up and essentially check patients for coronavirus so that these people aren't obviously going into the hospital and spreading it, and then they don't have to get out of their car. But that might also be a good option for pharmacists not to do the screenings, but to take the drugs out and do, a curbside pickup. I just got an email from Target saying that, they're trying to increase that business so that people aren't having as much face-to-face contact. So that might be a really great option. Drive-thrus in general, and then also, as we talked about prior, home delivery or, telepharmacy options as well.
As always, thank you so much for listening. If you have any questions, please reach out to me or Erica. As we mentioned at the outset, this is, again, a very fluid situation, so we hope to have more in the coming days and weeks.
And check out our website, Husch Blackwell Online, for even more insights about the coronavirus.